What are the current recommendations for prescribing glucagon-like peptide-1 therapies for adults with obesity? What's the latest on GLP-1 therapies in obstetrics? How should clinicians approach Chagas cardiomyopathy? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, December 5th, 2025. I'm Dr. Preeti Malani, JAMA Deputy Editor, and this week I'm sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today I'm joined by my co-host, Deputy Editor Dr. Chris Muth. Hi, Chris. We have plenty of content to discuss. Let's get started.
Hi, Preeti. First up, there's a JAMA special communication. It outlines guidelines from the World Health Organization on use and indications for glucagon-like peptide-1, or GLP-1 therapies for the treatment of obesity in adults. Dr. Cialetti and colleagues outline two major recommendations for adults living with obesity. First, they give a conditional recommendation with moderate certainty evidence that GLP-1 therapies may be used as a long-term treatment for obesity. And second, they give a conditional recommendation with low certainty evidence that intensive behavioral therapy may be provided for patients who are prescribed GLP-1 therapies as part of a multimodal clinical algorithm.
Speaking of GLP-1 therapies, JAMA also published a study about gestational weight gain and pregnancy outcomes after using GLP-1 receptor agonists. In this retrospective cohort study, Dr. Maya and colleagues compared gestational weight gain and other pregnancy outcomes like birth weight with and without exposure to GLP-1 receptor agonists before and during early pregnancy. The authors report that individuals who are prescribed GLP-1 receptor agonists with discontinuation before or during early pregnancy had a statistically significant difference in gestational weight gain, on average about 3.3 kilograms greater than those not prescribed GLP-1 receptor agonists. In an accompanying editorial, Dr. Sesta and colleagues discussed considerations for GLP-1 use in obstetrics. They highlight that while obesity and obesity-related complications can increase the risk of adverse obstetric outcomes, establishing the reproductive safety of GLP-1 receptor agonists before and during pregnancy is paramount. Although the study is not definitive, it provides valuable information to guide potential obstetric care decisions.
Yes, it certainly does. Preeti, now let's discuss a study about ECMO weaning in patients who experience severe but potentially reversible cardiogenic shock that requires veno-arterial extracorporeal membrane oxygenation, or VA ECMO, support. While this intervention can be life-saving, severe complications can result, especially with prolonged VA ECMO support. Dr. Combs and colleagues assessed whether early administration of levosimendan, an inodilator that enhances cardiac contractility, could reduce time to successful ECMO weaning. The team conducted the randomized double-blind placebo-controlled levo-ECMO trial with 205 patients from 11 ICUs in France. These patients were diagnosed with acute cardiogenic shock and had been started on VA ECMO within 48 hours prior to enrollment. The patients were randomly assigned to receive increasing doses of levosimendan or placebo, and the primary outcome of the study was time to successful ECMO weaning within 30 days following randomization. And the authors conclude that early levosimendan administration did not significantly reduce the time to successful weaning of ECMO compared with placebo for patients in this study. In fact, 68.3% of patients had successful ECMO weaning in both groups.
Dr. Drasner's editorial to accompany this trial raises an important point. He states that the trial's results are a reminder of the need to conduct well-designed, blinded, placebo-controlled randomized clinical trials with hard outcomes before adopting a therapeutic agent in clinical practice, regardless of biological effects that appear logical to treat a medical condition or observational data that suggest potential benefit.
Okay, and next, let's turn to another study. Patients undergoing open abdominal procedures are at risk for postoperative pulmonary complications after surgery. Intraoperative lung protective ventilation strategies aim to reduce these postoperative pulmonary complications. The designation investigators conducted a randomized clinical trial to evaluate different intraoperative ventilation strategies during open abdominal surgery. patients were randomly assigned to receive intraoperative ventilation with driving pressure-guided high positive end expiratory pressure, or PEEP, and recruitment maneuvers, or intraoperative ventilation with standard low PEEP. The primary outcome was a composite of pulmonary complications, including outcomes like severe respiratory failure, bronchospasm, suspected pulmonary infection, and atelectasis within the first 5 postoperative days. The investigators report that for these patients, intraoperative lung protective ventilation, like driving pressure-guided high PEEP and recruitment maneuvers, compared with standard low PEEP, did not reduce postoperative pulmonary complications.
Dr. Lopez and colleagues described the findings of the PARACHUTE-HF trial, which assessed efficacy and safety of guideline-recommended treatments for heart failure among patients with Chagas disease. Chagas disease, caused by the parasite Trypanosoma cruzi, affects more than 10 million people worldwide, but is still a neglected disease. A common complication of Chagas disease is cardiomyopathy, with Chagas cardiomyopathy possessing unique clinical features like focal myocardial fibrosis and a high associated mortality rate. The authors enrolled patients with heart failure and reduced ejection fraction attributable to Chagas disease. These participants were randomized to receive either sacubitril, valsartan, or enalapril in addition to standard therapy. The primary endpoint was a hierarchical composite outcome tested in order of death from cardiovascular causes, hospitalization for heart failure, or changes in N-terminal pro-B natriuretic peptide, or NT-proBNP, from baseline to 12 weeks. They report that there was no significant difference in clinical outcomes between sacubitril, valsartan, and enalapril. However, they did find greater reduction in NT-proBNP at 12 weeks in patients who received sacubitril valsartan.
Editorialist Dr. Gottlieb and colleagues clearly summarized the recent research in this area. They also explained that given the NT-proBNP biomarker efficacy without the clinical impact of sacubitril valsartan, there is still much more to learn about Chagas cardiomyopathy and how to best manage it.
Don't forget to check out the JAMA research summaries for the Levo-ECMO designation and PARACHUTE-HF trials. These new JAMA features are great resources for busy clinicians. Chris, let's talk about the JAMA research letters next.
Okay, the research letter by Dr. Bladal and colleagues presents individual-level data from the Danish Medical Birth Register to identify mothers who had filled a prescription for GLP-1 receptor agonists from the day of delivery to 182 days postpartum. They concluded that GLP-1 receptor agonists are increasingly used for postpartum weight loss, with gradual increases in 2022 and a sharp increase in 2024. And the research letter by Dr. Ramesh and colleagues used the 2008 to 2020 National Post-Secondary Student Financial Aid Survey to examine trends in federal loan use among U.S. medical students. This is especially relevant given the proposed loan restrictions from the One Big Beautiful Bill Act. The authors report that the use of federal loans to finance the rising cost of medical school attendance is increasing. They also anticipate that low-income and out-of-state medical students will disproportionately experience the effects of these loan restrictions.
Chris, recently overdose deaths in the U.S. involving psychostimulants, particularly methamphetamine, have increased sharply, often in combination with opioid use. In their letter, Angela Diadamo and colleagues examined trends in injection use of methamphetamine and opioids among people entering drug treatment in the U.S. Using data from the 2012 to 2023 Treatment Episode Dataset Admissions, or the TEDS-A, the authors report that the prevalence of injecting methamphetamine only or both methamphetamine and opioids increased significantly among people entering drug treatment. The results also note increases in areas where methamphetamine injection was previously rare, like in the northeastern United States.
Preeti, JAMA has several interesting viewpoints, starting with a viewpoint by Dr. Altman and colleagues in which they describe how the rising cost of healthcare is becoming an increasingly important issue for U.S. voters. And in a separate viewpoint, Dr. Malani considers the effects of the One Big Beautiful Bill Act on Medicaid and health insurance exchanges.
Chris, December 1st was World AIDS Day. The JAMA viewpoint by Dr. Tu and colleagues advocates for affordable HIV care. The authors discuss the importance of generic antiretroviral therapy and the barriers posed by combination-only drug approvals. Continuing with this important theme, Dr. Person and Kelly reflect on World AIDS Day 2025 and discuss current threats to HIV prevention and care, potential Medicaid cuts, and attacks on health equity while proposing a way forward.
There's also an interesting viewpoint from Dr. Palmieri and colleagues on AI in healthcare. They discuss new guidance from the Joint Commission and the Coalition for Health AI on responsible use of AI in clinical settings. And Doctors Carey and Maciejewski explain the utility of using real-world evidence in the upcoming Medicare drug price negotiations.
Thanks, Chris. Continuous glucose monitoring devices are becoming more common. Dr. Bergenstahl and colleagues contributed a JAMA Insights article that covers what to know about continuous glucose monitoring in type 2 diabetes. And there's a patient page on ovarian cancer that covers risk factors, diagnosis, treatment, and more for patients and their families.
There's also a second patient page on methamphetamine use disorder to complement the earlier research letter. It's a helpful read for patients to learn more about the effects of this highly addictive stimulant.
The JAMA review this week is on cannabis and cannabinoids. The article by Dr. Shu and colleagues include a helpful glossary of terms, a map of cannabis regulations in the U.S. by state, along with evidence-based clinical guidance, including harm reduction and informed use strategies. Don't miss the JAMA Clinical Reviews podcast to learn more about cannabis and cannabinoid use from JAMA Senior Editor Dr. Karen Lasser and review co-author Dr. Hill.
The JAMA Insights on Climate Change, Allergic Rhinitis, and Sinusitis by Dr. Mickeljohn and colleagues summarizes up-to-date evidence about climate change, air pollution, and sinonasal health. There's also been a lot of rapidly developing medical news, and our outstanding JAMA medical news team stays on top of it all and gets you the latest articles in clinical medicine, biomedical research, public health, and health policy. Find it all at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Chris, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Chris Muth and me, Dr. Preeti Malani. This episode was produced by Daniel Morrow, Ella Barnes, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.